The title of this talk is Access to Medical Care in Disabled Minority Populations. First, for some definitions, in the World Health Organization, the definition of health, it's a state of complete physical, mental, and social well-being. It's part of everyday life. It's really not the object of living, but part of it. It's considered a positive concept, emphasizing social and personal resources and physical capacities. Within that health definition, the term disability means the physical or mental impairment that limits one or more major life activities of that individual. There needs to be a record of the impairment. It's also being regarded as having that impairment. It's developed by the World Health Organization, the International Classification of Functioning and Disability. It provides a unified language and framework for the description of health. The ICF puts the notions of health and disability in a new light, bringing them both together. It acknowledges that every person can experience a decrease in their health and thereby experience some degree of disability at any time during their lifetime. And it mainstreams the experience of disability as a universal human experience. Within that definition of disability from the ICF, it serves as an umbrella for impairments, activity limitations, or participation restrictions. Impairments are problems in body function or structure that to some extent affect a person's ability to engage independently in some aspect of day-to-day life. This shifts the focus from cause to impact, so it's really goal-oriented, places the health conditions on equal footing, allowing them to be compared using a common metric. The ICF really tries to combine the medical and social models in order to provide a coherent view of health from a biological, social, and individual perspective. The ICF measures the impact of the environment on the person's functioning by documenting contextual or extrinsic factors. So who's disabled? In the U.S., 54 million Americans, or 1 in 5 people, are living with at least one disability. Most Americans will experience a disability at some time during the course of their lives. The most common description of disability are musculoskeletal or